a high stakes thing like medicine. I used to be a doctor, in case you didn't know, and medicine is all about following a system. Yes, there is some level of like individual stuff that the doctors do, for example, like, talking to the patient and making them feel nice, but when you go and see a doctor and you talk to them about your problems, the doctor is actually following a system. One of the most popular systems is the Calgary-Cambridge method of patient interviewing, which is like a whole system for what sort of questions as a doctor you need to ask the patient in order to make sure that you've got on all the symptoms and all the signs and all that kind of stuff. When the doctor examines you and listens to your heart and like examines your abdomen and all of that kind of stuff, again, they are following a system. They are not just making shit up as they go along. If they have lots and lots of experience, then yes, then the systemization of the thing for doctors starts to become second nature. They start to pattern recognize, and so they're following a system, even though they often don't realize they're following a system because the system has been so drilled into them that they can now kind of go a little bit off script. But even then, even if you're like a surgeon with 50 years of experience and you're like the world's best person, you still literally have to fill out a checklist before every single operation and at the end of every single operation to make sure that you've checked the boxes for the important stuff that the system needs to make sure the patient